Here we are, live and on time. Actually, a minute early. Hey, look at that. We're on it today. So hopefully, I don't think I can get that close to you. We are talking about...
Today we're talking about things that might come out of women's vaginas, which might include people, but there's a lot of other stuff that comes out of women's vaginas, and much of it is a clue to things that might be going on inside at the other end of the vagina, including the cervix or up inside the uterus, and things that could potentially have implications for overall vaginal, cervical, and uterine health that you might see come out of your body.
Not always.
So any questions that you guys have about things that may be coming out of your body or things that may be coming out of a friend of a friend of a friend's body, feel free to enter those in the comments and we'll answer questions as they come up. But Sarah's going to go over some of the most commonly asked questions about what should be coming out of where.
Or what
shouldn't did come out of there.
besides the babies.
Yeah.
So I know one of the biggest things we have, and we were just talking about this a little bit earlier today, about that ooey gooey sticky stuff that women sometimes find in their underpants.
Yeah. Yeah, that's sometimes
what's
normal and what's not. So that kind of depends on women's hormonal status. So it depends a little bit on what's going on with the woman's body, whether she's on contraception or hormone replacement therapy, where she is along the spectrum of life. So is she pre-pubescent? If she is, then that's a different thing. Is she post-pubescent and just a woman of reproductive age? Is she pregnant? Or is she postmenopausal? That's going to affect, or if she's taking medication that may dry up secretions everywhere, like Sudafed decreases secretions in all parts of our body. If all of those things are factors that contribute to the differences in what somebody might see coming out of their vagina or might find in their underpants, it is normal for vaginas to make discharge. They're actually kind of like our noses, and stuff comes out of our noses. Not all the time. It doesn't continuously leak out, but we go like this and sniff it back into our bodies, where we can't do that with our vagina
if
or
you can,
our cervix. If you can,
please let us know.
That's a party trick.
That's a talent.
I want to see it.
Yes.
Because that's impressive. So we will notice things coming out of our vaginas because they produce mucus, and mucus is basically snot. It's just coming out of a different area than our nose or than our throat when we cough things up. And because vaginas are mucous membranes, they seep things through the walls of them and they produce what comes out as discharge. A lot of what comes out, however, some of it's coming from the vagina, but a lot of it is coming from the little tunnel of the cervix, which actually releases a different fluid depending on where you are in your cycle or depending on the different kinds of medications that you're taking, depending on whether you're premenopausal, postmenopausal. We know that stuff comes out of our cervix and then ends up coming out of our vagina because we have vaginal bleeding, which is not coming out of our vagina. It's coming out of our uterus, and our uterus is releasing it through our cervix. So it's releasing it out of that tunnel, and then we notice it coming out of our vagina, but it's not actually our vagina that's bleeding. It's actually coming out of our cervix. So a lot of the things that you notice coming out of your vagina may or may not actually be vaginal discharge. It could be cervical discharge. It could be something that's in your uterus that's coming out of your cervix. And it's almost impossible for a woman herself to be able to tell that because the only entrance that she can actually observe is the vagina. So she thinks it's all vaginal.
Yeah. So when a woman is coming in with this complaint of this discharge in my underpants and wanting to know what's normal and what's not, I know yeast is a very common complaint. Sometimes women have odors that come out of their vaginas, different colored discharge outside of bleeding. What are some more kind of common, I want to say like surface level vaginally produced concerns.
Okay, so a lot of times people think they don't have a yeast infection because they don't have chunky stuff coming out, right? We associate yeast infections with chunky vaginal discharge, like cottage cheese, curd-like chunky discharge. If you're at that point, you got a hell of a yeast infection. So if you're waiting until you're noticing that chunky stuff coming out, you've probably had the symptoms for a long time, haven't responded to them, and now you got a serious problem. Which does go away, like it's totally treatable, but that is the more advanced yeast infection or candida inside the vagina that causes the discharge. So a lot of times ladies will think they don't have a yeast infection because they're not noticing that stuff, but early yeast infections don't produce chunky discharge. The chunky discharge tends to come when the yeast infection's been there for a while, it's percolating, and then it starts causing that discharge. That discharge is similar to, we get yeast everywhere, right? Like it's just an organism. It's not in and of itself a pathologic organism. So it's kind of normal to have yeast like on your skin, in your mouth, inside our bodies, and inside our vaginas. Even in our bowels, we can have yeast or different kinds of fungus. It's only pathologic if it's overgrown. So if there's a lot of it in there, it can cause irritation, it can cause inflammation, it can cause itching, it can cause other things to happen. And then ultimately, it does cause a white discharge. Babies who often get yeast in their mouth because they have a sugary substance that's in their mouth all the time, if that yeast starts to grow, it's a fungus, so it's like mold grows on bread or fruit, which is sweet, it tends to get moldier faster than other kinds of foods. Bread is a carbohydrate. Mold thrives on carbohydrates. It loves sugar. So anything where there's a lot of sugar or a lot of moisture is more likely to grow yeast. And what you'll see in a baby's mouth, if a baby gets yeast in his or her mouth, you'll see a coating of the tongue or white stuff, like white chunky stuff in there. The same thing happens inside the vagina. Remember, they're made of the same thing. It's the same tissue. So the same thing happens in the vagina, and you can end up with that chunky discharge coming out. If you see chunky discharge, however, if you see a thicker, pasty, chunky stuff coming out and you're not having symptoms of itching, you do need to come in and be evaluated to make sure that it is actually yeast. If you're seeing chunky discharge and you're having irritation, certainly it's your vagina. You can treat it over the counter and see if it goes away. If it doesn't, then it's entirely possible that there was something else that was causing that discharge and that it wasn't just yeast. Other things that are common.
That odor.
Yeah. Sometimes stuff smells bad just because it smells bad. So like semen, if it's in there,
so bad.
It smells bad. If it's in there and it's stayed in there overnight and you get up in the morning to go pee and you smell it, it smells bad. Like it does not smell good. That is not pathological. That is just semen. Like it smells bad when it's been inside of you overnight or for a few hours. It can smell bad. That should go away when you shower though. You take a shower, it's gone. It should generally go away. Like the semen doesn't stay in there unless you're like putting it back in there constantly. You shouldn't have a stinky semen smell.
Right.
Like it shouldn't smell like that all the time. If you're noticing odor to be more profound, but if there is an odor, vaginas really shouldn't smell bad. So we don't need to get like the feminine deodorant spray because you shouldn't really need it. If you're needing to spray something down there to cover up a stink, something's going on. And along with that, you'll probably notice a change in what's coming out of your vagina. So it may change in color, it may change in consistency, it may change in quantity. Like there's all this stuff coming out because typically if there's a really profound odor, that's a sign that there's something bacterial. Sometimes bacterial vaginosis, so sometimes Gardnerella, which is one bacteria that can get in there and cause a problem, but other times other stuff that comes off of other things that might go into our vaginas or might come into contact with our vaginas. If we get into a hot tub that has some bacteria in it that hasn't been appropriately chemically treated or isn't hot enough to kill the bacteria, that can get up inside of our bodies, and because it's a cul-de-sac, it just kind of pools in there. And that bacteria can then start to proliferate inside the vagina. It's kind of a bad system, the way that our bodies are made. Like, no, if I get to ever make a complaint to the person who decided how our bodies should look, I will say, God, why did you do that? That was a bad idea. If I have one complaint about the female body, it's that the butthole is as close as it is to the vagina. And the reason is that the bacteria that's in our bowel should not be in our vaginas. And it gets in there pretty easily, especially if we're doing things like wearing thongs, taking baths, because we in this country use toilet paper and not bidets to clean our butts after we go to the bathroom. And so there can be residual fecal matter bacteria that we don't see as like a brown streak in our underwear or on the toilet paper. And that can get into our vaginas. If we get into water, it contaminates the water. Like I said, the vagina is a cul-de-sac. It gets into the vagina and it can cause an infection. So that could show up as an odor, not necessarily a poop smelling odor, but a different odor and something that women notice. Typically, if there's a bacteria that's causing the odor and you're noticing an odor in the discharge, typically if it's a bacteria, our bodies are good at fighting infections, right? Like they want to get rid of infections. Sometimes they can, sometimes they can spontaneously, and sometimes they can't. Sometimes they need some help with something to kill the bacteria. But our bodies will recruit white blood cells and will preferentially send them to the site of the bacteria. That's what pus is, right? Like if we get an infection in a skin sore, or we get an infection in like a scab that we keep picking and getting bacteria in, it will start developing pus, and pus is white because it's full of white blood cells. Basically what happens when you have a vaginal infection that's caused by bacteria is your body recruits all these white blood cells, puts them inside your vagina, and that's what pours out. It's pus. That the same thing will happen if you have any kind of bacterial infection. So gonorrhea, chlamydia, which are both bacteria that can go away with antibiotics, the Gardnerella that causes bacterial vaginosis, something that came off of somebody's mouth, that's mouth flora because we get bacteria around our teeth. We get bacteria like strep throat, and that can sometimes enter the vagina if there's contact. Something that came off of somebody's fingers or from underneath the fingernails, or something that came off of somebody's penis, or something that came off of our own body could end up inside of our vaginas and cause a bacterial infection. Typically, those are pretty easy to treat, but women will try to cover up the odor because they think the odor is the issue, and that's not really the issue. The issue is the bacterial overgrowth, and that needs to be addressed. Now, things like yeast infections and bacterial infections cause the tissue to become inflamed. So it causes the tissue to become irritated and inflamed, typically causing some itching, maybe some burning. Maybe you notice with intercourse, if he ejaculates inside of you, it feels really hot and like, oh, why did that feel so terrible? And that's basically because semen is really basic. So it's really like baking soda, it's really caustic, and it can cause burning in inflamed tissue. So if there's inflammation inside the vagina, that tissue is more friable, and people might notice some bleeding after intercourse. The bleeding doesn't typically come from the vaginal tissue, though. It typically comes from the cervical tissue, from it being irritated. Because if you've got an organism in there that's causing inflammation, that inflammation is also going to happen on the surface of the cervix. Now, I have a theory, which I think is correct, but which I need some research money to actually find out if it's correct. I don't think that cancer can occur in a setting that is not inflamed. I think that inflammation is always necessary for cancer to develop. And we know that if women have chronic vaginitis, if they have chronic infection inside their vagina, they are more likely to have abnormal pap smears. They are more likely to have their abnormal pap smears progress, and they're more likely to get another STD. And the reason is those cells are more easily penetrated, they're irritated, they're inflamed, the cancer cells can then hold on to them and procreate and become a bigger problem than it would have been otherwise. So vaginitis, wherever it's coming from, whatever bacteria, whatever yeast is causing it, needs to be treated, and needs to be treated in a timely manner so that we don't have things like that happening. If we had the cells on our cervix that were precancerous and we had vaginitis, the chance of that becoming a bigger problem is much higher. So we want to make sure that those infections get treated in a timely manner.
I don't know what you guys do while you're sitting at a stoplight in your car, but welcome to the brain of Morgan at a stoplight in the car.
I think about inflammation because I'm a nerd.
So when a woman has this concern of an odor or discharge, I know a lot of the women that we see are very mortified and humiliated and embarrassed by what's going on. Mm-hmm. They shouldn't be.
No.
It happens.
Well, it doesn't necessarily mean that they're dirty, right? Like a lot of people think that it does. And, there's like this commercial capitalization on women thinking that they're dirty, right? They're scented, all kinds of scented stuff that you can get and use to cover up your vaginal scent or stench or whatever. Like, you walk down the female hygiene aisle and you can find all this stuff that's supposed to make you smell like Hawaii to cover up your rotten stench, but it's not treating the problem, and it will make the problem
smell like
worse.
Hawaii.
You don't smell like Hawaii. You smell like Hawaii with fish behind it. You smell like
that part of Hawaii is accurate.
And it tends to make it worse. So it tends to further irritate the tissue because of the chemicals that are then coming into contact with the tissue that's already irritated. It tends to cause more discharge. It tends to allow that bacteria to proliferate more because you're irritating the cellular component and irritating that tissue more. But there's a lot of it and women buy it. Like, it wouldn't still be on the shelves at Target if it wasn't being purchased. They would get rid of it because it's not making them money. But it's making them money, and it's making the companies who produce it money because women don't know how to manage this. And it's so embarrassing. Like, they don't want to call and say, gosh, like, I really stink and something's going on. Like, they would rather take care of it themselves. The problem with bacterial infections in the vagina is, unlike fungal infections in the vagina, which sometimes if it's caught early and it's not a complicated infection, sometimes we can just get rid of them by using an over-the-counter preparation. The same is not true for bacterial infections. And part of that is that it's kind of dependent on what the bacterial agent is. The other thing is, sometimes people are really mortified because they've acquired a sexually transmitted infection, which is just a bacteria that goes from one person's body to the other person's body. So it's basically like getting strep throat, but inside your vagina, and that causes that irritation. Just like you would for strep throat, you get antibiotics and it goes away as long as you're not repeatedly exposed to it. So women do worry about that because they don't want to tell anybody, like, ooh, maybe I got chlamydia, and they certainly don't want to be diagnosed with it. But there's so much stigma attached to infections that we can get inside of our vaginas because people think we're dirty. Nobody has a stigma about strep throat. Nobody has a stigma. If you have a sore throat, you go and get your throat addressed, and then you take the antibiotics and your problem goes away. I would like to fight the stigma that there is around women having vaginal infections and vaginal concerns, but unfortunately it's very culturally ingrained. I mean, it is a thing. And I don't think that I can dismantle that entirely on my own.
I was just gonna say, not on our own, at least. No. We need your help.
Yeah.
So those are very common things that happen to women. What about if somebody came in and was complaining of maybe stool or fecal matter coming out of their vaginas? Because that happens.
Yeah, it does happen. Yeah. So that happens from what's called a rectovaginal fistula. So if you imagine the vagina as a tunnel, and there's a tunnel here, which is your rectum, and then there's a tunnel here, which is your urethra, which is a very small, short tunnel, but it goes to your bladder. There are some things that can cause these separations in between those tunnels to erode, and you can get a hole in that area in between the vagina and the rectum, or in between the vagina and the bladder. So you actually might end up with urine leaking out of your vagina. And people don't know where it's coming from, right? Because they think they're just leaking urine, and they think the urine is leaking out of their urethra. And if somebody doesn't go looking and doesn't demonstrate what's happening, it may actually not be coming out of their urethra. It could be coming out of the vaginal wall. And then the other thing is true for feces. So you could have poop coming out of your vagina because there's a hole in between your vagina and your rectum, not on the outside. So in that tunnel, something has eroded on that posterior wall of the vagina, and it's allowing the poop that's in the rectum to kind of come up and seep out. If you're having incontinence, so if you're having leakage of urine, or if you're having leakage of stool, one of the first things that needs to be established as a female is that it's coming out of the appropriate place. So, because that's a different monster. If it's coming out of your anus or it's coming out of your urethra, at least it's coming out of the right place, and it gets approached from that perspective. If it's coming out of your vagina, however, that is a different problem. And things that can cause erosion in that vaginal wall are things like trauma, maybe by a baby's head, maybe by forceps that are put inside of us, that trauma not being appropriately addressed or identified. So there's something called a 4th degree tear that can happen during labor, during delivery, which involves tearing through the vagina, all the way through that separation between the vagina and the rectum, and right into the rectum. And if that's not repaired and healed properly, you can end up with these little tiny holes, which are tracks from the rectum up into the vagina. So that kind of repair needs to be done meticulously, and it needs to be checked meticulously afterwards to make sure that there isn't some kind of leakage. Now, typically what would happen is women would start to notice that they're having, it's not like poop, right? So it's not leaking out as poop because it's mixing with the vaginal discharge. And because feces have bacteria in them, typically you would also have your body recruit the same bacteria as if you had gotten bowel bacteria from water or from a thong or something inside of your vagina. The same thing would happen. Your body would recruit white blood cells that would try to fight that. And so you would have kind of this runny stuff that was off colored. So it would not necessarily look like poop. You wouldn't know that it was poop until somebody told you that that's what it was. The other things that can cause erosion, though, are being postmenopausal or not having enough estrogen in your body for any variety of reasons. So some women have what's called premature ovarian failure or hypogonadal hypogonadism, which if you have, I'm sorry,
Word of
come
the
in,
day.
we will treat you. It's where your body just doesn't, your ovaries don't produce enough estrogen, and that results, and that can happen to somebody who's 20. You don't have to be 70 to have this happen. That can happen to somebody who's 20, and what it causes is vulvovaginal atrophy. So it means that the tissue shrinks, it becomes less pliable, it's more likely to erode and end up with a disruption in that separation between either the bladder or the rectum. And that can happen from simple things. That can happen from penetration. I mean, that can happen from something that wasn't previously uncomfortable that is now both uncomfortable and disrupting that barrier because the barrier gets so thin. So that's something that you want to, as a woman, make sure is being managed well enough to support that tissue and to prevent it from resulting in a tear that creates a bigger problem.
And sometimes I know women sometimes notice like gas coming through prior to stool sometimes. So
Mhm. Yeah, if there's
passing
gas, but it feels like it's coming out of the vagina, that's different from like a queef. That's a different thing.
moving.
It's because vaginas are cavities, right? So just like our stomach's a cavity and we burp, you can get air in there that gets trapped, especially during yoga. Happens a lot during yoga to people.
That's why I don't do yoga.
But you can get air that gets trapped and then gets released. There shouldn't be air that kind of spontaneously is coming out of your vagina. If there is, then you do need to have an evaluation to make sure that it's not gas coming from the bowel and then being released through the vagina through one of those small tracts.
Could there be a brown colored consistency discharge that comes out that's not stool? That could be
Blood? Yeah.
Old blood, dry blood, dark blood.
Yeah, so there are also all kinds of different colored things that come out that are not, have nothing to do with your bowel, and some of them are brown. So, and depending on what kind of discharge there is in the vagina, if there's something brown that's being released, it may be coming out of the cervix. So it may be like something that's coming out that's uterine. So it might be part of the lining that's trying to shed. Women who are on oral contraceptives often have this happen because they're not building up and building up and building up that lining. So it doesn't look like red blood when it comes out. It just looks like this old brown stuff because there's not something that's new and fresh being made inside of there. So if they have breakthrough bleeding, they may notice some brown stuff coming out, and that's coming out of their uterus, exiting the cervix, and then ultimately coming out of the vagina. Sometimes there can be some bleeding at the surface of the cervix, and everybody's cervix is in a different place, right? Like some of them have it more anterior, some people have it right dead center, and some people have it where it tips towards their back and it isn't just dumping things directly down into the vagina. And the vagina is a cul-de-sac, but it's a collapsible cul-de-sac, right? Like it's not constantly open. It's smushy tissue. So secretions from the cervix can actually get trapped up in the vagina. So they could be in a little fold of the vagina up there. And then you move a certain way, or you put a tampon in, or somebody put something else in, and then a little bit of what was trapped up there might come out. So you might notice some brown discharge after intercourse, or you might notice some brown discharge if I don't know. You might notice some brown discharge all the time, or you might notice some brown discharge at any point, and it may be coming from your uterus, it may be coming from your cervix. If it's persistent and it's not going away, if it happens occasionally, it's not really a problem. But if it's happening after menopause, that is a problem. Any bleeding after menopause needs to be evaluated, and menopause being defined as a full year, an entire calendar year, 12 months of zero bleeding, not being on hormones, but just bleeding stops and doesn't come back. If you start having bleeding of any kind, brown, pink, red, whatever, you need to come in and be evaluated, because that is not considered normal and could be a sign of something much more problematic. But if you're a woman of reproductive age, you're having regular periods, or you're on birth control, or you've had some like profound, really rough sex, and you notice a little bit of brown stuff coming out, that's okay. Sometimes it can be chunkier depending on where the woman is in her cycle. So it could, if you're not on birth control, you're not taking hormones, you don't have something that's suppressing your ovaries from making their own hormones, vaginal discharge changes over the course of the 28-day cycle or 30-day cycle, where it's a little bit thinner in the beginning of the cycle, then it becomes really mucousy, like slime, like slug slime. And that's what's called Spinbarkite, named after some German dude, probably.
Spinbarkite.
Spinbarkite.
Next word of the day.
That's cervical mucus, and that is actually something that evolutionarily happens to preferentially transfer sperm into the uterus. So it catches sperm because your ovaries are getting ready to release an egg. So when you notice that slippery stuff, it's happening because it's trying to get you pregnant.
Don't get pregnant.
And if you don't want to get pregnant, you should be careful about it. But if you do want to get pregnant, that's a good thing to notice, because it means that your body's getting ready to ovulate. And it happens in response to the hormones that are released prior to ovulation. So that's something that some women notice, like typically when they wipe, whoa, that was slippery. And then they look at the toilet paper and there's something that looks like egg whites on it. That's cervical mucus that's associated with ovulation. Weird. I know. But
good to know, though.
We think we're in more control of when we get pregnant than we are. And we think we have more control over what drives our sex drive than we do too, because that's hormonally mediated and there is this cycle to it. So women are more likely, because of the hormones, to want to have sex at the same time as that slippery stuff is coming out, which is why sometimes women experience a decrease in libido if they have something that's suppressing their ovarian hormones. Some women only feel like they want to have sex when they're actually ovulating, and birth control prevents ovulation. So sometimes women will notice a decrease in libido. Sometimes they don't. Sometimes it helps their libido, but it's very individual. Anyway, that slippery stuff happens usually mid-cycle. If you have a 30-day cycle, like usually around the 16th day of your cycle, you'll notice it. If you have a 28-day cycle, then like the 14th day of your cycle, with the first day being the very first day that you start bleeding. So you get blood, then you get a little bit of like downtime with very little coming out of your vagina, then you get the slippery stuff, and then after you ovulate, you get this weird, tacky, pasty, snot-like stuff that comes out. And people are like, what is that? It's not pathologic. It's just in response to the hormones. So your progesterone starts to increase after you ovulate, and that causes your body to make a different kind of discharge. And it is a pastier discharge. So it's stuff that makes like a crust in your underwear. It looks a little bit more like snot initially, and then it looks a little bit more like just odd stuff. There's nothing wrong with it. It's totally normal. That is what your body makes in a normal cycle without. Can you still ovulate while breastfeeding and not bleed? Yes, you can. Because we always ovulate before we bleed, which is how people get pregnant while they're breastfeeding. And they'll say, my period never came back. How could I be pregnant? So the egg comes out. Sometimes you can have weird little spotting, and that doesn't necessarily mean that you're ovulating, but bleeding is not what's going to tell you that you resumed ovulation. Your first period after you stop breastfeeding, or while you're breastfeeding and maybe the baby decides he or she doesn't want as much milk and your brain starts letting the eggs come out of your ovaries again, your first period means you've already ovulated, because you ovulated 2 weeks before you got your period. If you don't get a period, it doesn't necessarily mean you're just still breastfeeding. It might mean you also got pregnant, because if you release an egg and you don't bleed 2 weeks later, You could be pregnant, or you could just be breastfeeding and not ovulating. And that's usually how people accidentally get pregnant with trying to suppress ovulation with breastfeeding. The baby goes a little bit longer, you go on a trip, you forget to pump, something happens, and those hormones that are released from your pituitary gland tell your ovaries, all right, let's go. The egg comes out, you haven't gotten a period, you don't think you can get pregnant, and actually you are. So that's why when you're using what's called the lactational amenorrhea method to prevent pregnancy, sometimes it works, sometimes it doesn't. It depends a lot on how much you're actually breastfeeding. And for some women, they have no ovulatory suppression with breastfeeding. So just like everybody's body is different, they respond to the stimulation that releases prolactin and oxytocin differently. And some women ovulate right through it. They go back to ovulating, even if they're breastfeeding all the time. They start having a period at 12 weeks and they're ovulating regularly and need to do something else. I know. Yeah. Yeah, but some women don't. They have complete amenorrhea and don't get a period the entire time that they're breastfeeding, and it's not as much of an issue for them, but they think that they're not ovulating, and it's really hard to know when you're going to go back to ovulating. I wish that I could say, no, you got a good 2 years, like you'll be fine, but I don't know because it's so variable from woman to woman, and those hormonal fluctuations that are happening both in our brains, our thyroids, our ovaries, as a result of how much weight we're carrying, as a result of what we're eating, what we're exposed to, all of those things can influence when our bodies decide to start ovulating while we're breastfeeding.
So crazy.
The other thing that I want to mention before we go is blood that comes out of the vagina. So blood that comes out of the vagina, often people think all of it is from the uterus, that it's all coming out of the uterus. It's all period blood. It's all related to something that has to do with the uterus. I know, Megan, and still not pregnant, I hope. If that's what you want. If you want to be pregnant, then I want you to be pregnant. But if you don't want to be pregnant, then I don't want you to be. I breastfed one of my children for 2.5 years and did not get a period then.
Just kidding.
I know. So for me, it was a great suppression of my ovaries. I could also tell when I became fertile again, which was an unpleasant experience. I had a very poor return to fertility. And it was well after that 2.5 years. So it took a long time for my body to restore its hormonal function, but I can't guarantee anybody that the same thing would happen for them. And I can't guarantee anybody that they wouldn't accidentally get pregnant. Megan, good. I'm glad. If you want to get pregnant, then go ahead. But otherwise, I do hope that those no periods also mean that it's just from breastfeeding and not that you're pregnant. Anyway, the other thing that I wanted to address was bleeding that comes out of the vagina, which is not always indicative of uterine bleeding. So it's not always coming out of the uterus the way that a period comes out of the uterus. Sometimes, be careful, Megan. Just be careful.
Sorry.
Sometimes the bleeding is coming from other sources. So if you're having unusual vaginal bleeding, if you're noticing vaginal bleeding, first of all, if you're postmenopausal, you need to call right away because we need to make sure that's okay, Megan. That's what happens. It's a conversation, and conversations go different places. If you're postmenopausal and you're having bleeding, I don't care what color it is, you need to call us and tell us that it's happening, because bleeding should not be happening once you've stopped having a period. It may or may not be coming out of your uterus, but we still want to evaluate and make sure that's going on. If you're not postmenopausal and you're having bleeding that's unusual for you, we need to make sure that it's coming out of your uterus first and foremost, and that it's not coming from somewhere else. Because remember, the only thing you know when you see blood in your underwear or on your liner or on a pad is that it's coming out of the tunnel. You don't know where it's coming from, and we can't necessarily assume that the bleeding is coming directly from your cervix, ending up in your vagina, and then coming out. So we need to make sure that it's not coming from another structure. Sometimes it's coming from the uterus, sometimes it's coming from the cervix, and that can sometimes be one of the first signs that there's something going on with the cells of your cervix that needs to be evaluated further. Because if the surface of your cervix is having bleeding on its own, and it's not coming out of the little hole in the cervix, but it's coming out of the tissue on the cervix, that's concerning for inflammation in the cervix. It's also concerning for precancerous or potentially cancerous cells. So we need to check and make sure that that's not something that's happening. And if there's inflammation, just like I said, I have a theory that cancer can't happen without inflammation, and that inflammation prompts cancer. So if something's inflamed, let's uninflame it. Like, let's fix the problem that's causing the inflammation. And then sometimes we can actually have bleeding that is vaginal. We call bleeding vaginal all the time, but it's typically not coming from the actual vagina. It's just exiting through the vagina. But you can have vaginal bleeding if you have a tear, if you have a sore, if you have something that's happened inside of your vagina. And so if you're having bleeding that is unusual that you're noting and it's coming out of your vagina, the first thing that should be evaluated is it actually uterine bleeding? What's the source of that blood? And I think that that's an important thing that we frequently don't think about, because we think if it's coming out of our vagina, it's probably a period, but often it isn't. Often it's coming from another source that happens to be tucked up in a place we can't see. So if that's happening, call and let us know. We'll take a look and evaluate it. If you think that there's some kind of inflammation or infection that's causing you to have weird vaginal discharge, call and chat with us. We don't care if it smells bad. We don't care if it's an infection with a bacteria that we can treat with antibiotics. We don't care if it's a parasite, which can also happen. We don't care what it's coming from. We just want to get you healthy and let you live your best life with your vagina, however you want to use it. Anyway, we are 5 minutes over.
On that note,
we have
that's a good one to end.
a patient who's going to be here shortly. So send us your questions and we will post hoc answer them, or give us a call if you have any questions. If you think maybe this is normal, maybe this is not normal, but you're concerned about it, we can always tell you whether it's normal or not.
Come in and see us.
And have a great weekend. We'll see you next week.
See you next week.